Are TENS units good for you? Are they going to be beneficial? This is actually a question I get quite a bit. And some of you may already use the TENS unit, which is fine. Just make sure you know what you're doing whenever you're using them. But those of you who don't know what a TENS unit is, basically it's an electrical stimulation device that runs a current in a different waveform or a different frequency, if you will, and it contracts the muscles and it relaxes the muscles. Okay, so when most people use a TENS unit, it's going to be for pain relief or to relax a muscle. Kind of goes hand in hand in some levels. Now, the reason it can be good is because it does work to relax a muscle. And the way it does that is actually it'll cause a contraction. It's going to think of a hot wire fence, if you will. Whenever you grab it and the current's going, it's going to cause your muscles to contract and squeeze. And whenever it stops, your muscles relax. So basically what it's doing, it is fatiguing your muscle to the point where it's just going to relax and it's not going to be as tense. So on that level, yes, it does work. For pain relief, kind of the same thing. If you do have a unit that you can change the frequency on, there are different frequencies you can use for different conditions, and we're not going to get all into that, but if you have an electrical stim device that can change the frequency, there's all sorts of different things you can use them for. And those would be the best ones to use, in my opinion, if you're going to do something on that end. Now, the downside to it, whenever you're using a TENS unit, because it's a alternating current and not a direct current, what you get going is you can have quote unquote collisions, if you will. Think of it like a two-lane highway. So you got traffic coming from two different directions this way. And every now and then you might have a collision, which can actually cause an adverse reaction in your body. They may be rare, but it's possible. Some of the studies have shown, or at least suggest, that there may be nerve interference that it can cause out, like a nerve burnout. The other thing, it can potentially cause the muscles to be a little bit more painful, whatever the case is. Those are kind of rare on that end, but they are potential. Now, the downside to any of it, even though it can relax the muscle and actually help a little bit with the pain, it's not actually getting down to the cause of it. Okay? One thing with a muscle, the reason it's tight, it's probably protecting something that's injured. So you don't necessarily want to stretch it out. You don't necessarily want to relax it without actually getting down to the actual cause of the issue. And whenever you correct the issue, the muscles tend to relax on their own. Yes, it can take a while. Yes, you may want to get a little bit of relief or try to get the relief quicker. And who wouldn't? I don't blame you. But you always want to get to that root cause so it doesn't stay tight and you're not constantly having to shock yourself and increasing your risk for those adverse reactions to occur. Now, there are some people that will say that those adverse reactions don't occur. I'm not the person to sit there and say yes or no. I just know there's a potential for it. If it's actually going to happen or not, that's a whole different issue. Now, the other end, the device we use in the office is a direct current. So the direct current is going to be more like a two-lane or a four-lane highway where you got traffic going all one way on one side and down the other way the other side. So there's less chance of collision for crossing traffic, if you will. So, and this is actually the way your nervous system works. And this is a way, if you have a device that does direct current, which I don't, as far as I know, you can't get a home unit on this one. There are units that you can use and bring into your home, but they're not going to be the small ones. But they can be used for a far wider variety of things. And they actually get down to removing the threat in the muscle that's causing the spasm in the first place. Now, if it's a joint issue, if it's in the back and your spine's misaligned, it's not necessarily going to fix that, but it's going to work along the lines of the nervous system to help change the signal in the muscle itself instead of just trying to get it into submission, basically. But whenever it comes down to it, the ultimate cause is going to likely be in a joint somewhere, which is all going to be brain related because the brain controls everything, right? Nervous system is the brain, spinal cord, and all the nerves. And if you're not getting proper communication from the brain down the spinal cord and out to the nerves to their end range or end goal of where they're trying to get to, you're going to have dysfunction. So always look to the result of getting, or go for the goal of getting the cause cured and fixed. That way you get down to the core of it. You don't have those problems long term, and you don't have to rely on some external device just to try to get through the day. Get your body working optimally as possible so you can just work and be and not have to rely on something. It's just how you are. If that makes sense any at all, because you're designed to heal, you're designed to function efficiently and be pain free. Not saying you won't ever have pain, but that's not your normal state. So if you can get as close to that normal state as possible, your life's going to be better in general. And again, you don't have to shell out extra money or time trying to get the pads on. So you got to replace the pads, and you don't have to set yourself up for any discomfort that may be undue to you. So hopefully this isn't getting to be too much of a rant, but that can be one of those things that if you have one, be smart about it, make sure you know what you're doing, but realize there's always an underlying cause. Just because you're able to shock a muscle into submission doesn't necessarily mean the issue's fixed. So always get the issue fixed, get it looked at by a professional, and that way you can live the life that you deserve to live. All right. Have a great day, guys. Bye.